Um, I'll describe the subacute combined degeneration of the spinal cord, which occurred due to the deficiency of the vitamin B12. Um, Vitamin B12 deficiency occurred due to various causes like nutritional deficiency, gastrectomy, IVS, or other cause like metformin injection. Now, coming the point that deficiency of the vitamin B12, the destructions of the dorsal column of spinal cord. After destruction of the dorsal column of spinal cord, actually dorsal column involved for the sensory sensation. After destructions of the dorsal column, loss of the proprioception occurs, and we can we can diagnose this case by a test called the Romberg sign. Romberg sign is that once a person stands and close her or his eyes, after that, if there is a deficiency of vitamin B12, then they fall back, and this is occurred due to proprioception loss, and we call the Romberg sign positive. Deficiency of the vitamin B12 also causes the destructions of the motor tract, that is lateral spinothalamic tract. If we subscribe to the all the name of subacute combined degeneration, subacute means slow progressive pathology, slower progressive pathology, and combined means involve the sensory or motor tract, and degeneration means physical destructions of the nerve. So after that, if we call the subacute combined degeneration of the spinal cord, that is slow progressive pathology involving the sensory and motor tract and destructions of the nerve tract. Now coming to the destructions of the motor tract, that is the lateral spinothalamic tract. Lateral spinothalamic tract is the upper motor neuron tract. So after destructions of the motor tract, we lost the inhibitory response. So after destructions of inhibitory response, the lower motor will be exaggerated. So knee jerk will be exaggerated, and if we think that is knee jerk, when knee jerk will exaggerated, ankle jerk will be, but there is some pathology, deficiency of the vitamin B12, also destructions of the peripheral nerve, that is called peripheral neuropathy, peripheral destructions of the nerve. After destructions of the peripheral nerve, then loss of the ankle jerk. Ankle jerk root value is S1. So S1 is the peripheral nerve, but knee jerk root value is L3 and L4, that is the spinal cord level. And destructions of the upper motor neuron, knee jerk will be exaggerated, and destruction of the lower motor neuron, that is peripheral nerve, ankle jerk will be lost. And the Babinski sign also positive here. Here we show the lesion that is occurs in spinal cord levels, and knee jerk will be exaggerated. Tibial nerve is the peripheral nerve, so destructions of the tibial nerve, that loss of the ankle jerk also. And the sensory pattern loss is the gloves and stocking pattern sensations. As the peripheral neuropathy, S1 fiber will be lost. And here they're showing some dead circuit breaker, brain innovation lost, the spinal cord dorsal column lost, and in the peripheral nerve lost, that is called the zero circuit. Okay, then coming to the gist of today's sessions, that is after destruction of the dorsal column, that is the sensory tract, proprioception will be lost, and we can find a sign, that is positive Romberg sign. And motor function, motor neuron, upper motor neuron lost. The functional loss is loss of the descending inhibitions, and clinical sign is increased the knee jerk. And peripheral nerve is distal S1 fiber death, absent the ankle jerk. Okay, here is the descriptions of the subacute common degeneration of the spinal cord.